My name is Mia Flavin, and I am a senior nursing student at Westchester University.
And my name is Kelly Remy, and I am also a senior nursing student at Westchester University.
Today we will be discussing nebulizer treatments, their equipment setup, and medication administration through this device. Objectives include a review of the equipment needed to administer a nebulized medication, a review of the nebulized medication administration procedures based on current evidence and nursing practice standards, a review of the signs and symptoms that indicate the use of a nebulizer treatment, to become aware of medications that can be nebulized, and to become aware of possible adverse effects from bronchodilators and post-administration patient teaching points.
Compressors are designed to compress the air that flows through the medication cup and convert the medication into a mist that can be inhaled.
A nebulizer can also use oxygen to convert the medicine into aerosolized particles that can be inhaled from the mouthpiece or face mask.
The tubing of the nebulizer is connected to the nebulizer and the compressor.
The medicine cup holds the liquid medication that will be converted into a mist. To open the cup, twist the top off. To open the medication, twist the perforated edge of the ampule. Squeeze the medication into the cup in the space around the centerpiece and screw the cap back onto the cup.
The mouthpiece attaches to the medicine cup that is attached to the nebulizer. The mouthpiece is used for inhaling medication through the mouth, requiring you to hold it securely between your lips during treatment.
A nebulizer mask looks extremely similar to a typical oxygen mask found in the clinical setting. However, unlike a mouthpiece, the face mask covers both the mouth and the nose and is secured to the patient's head with elastic bands.
Now we're going to put together the nebulizer.
I'm first going to plug the compressor into the wall. Now I'm going to prepare the medication inside the medication cup, which is done by twisting off the top of the medication ampule and squeezing it in around the centerpiece. Then I'm going to screw the lid onto the cup. I'm going to then attach the mouthpiece. I'm going to take our tubing that we use and connect it to the bottom of the medicine cup. And take the other end of the tubing and connect it to the compressor. And once those two tubing connections are securely tied on, we'll start our nebulizer treatment.
When do we use a nebulized medication?
Great question. Patient assessment findings, specifically respiratory focused, that indicate the need for nebulized medications include wheezing and rhonchi.
This next clip will demonstrate what wheezing sounds like.
And this next clip will demonstrate what rhonchi sounds like.
Feelings of chest tightness, dyspnea, and cough are common with wheezes and rhonchi as the body goes into fight or flight mode to open the airways. While many patients can present with these lung sounds indicating the need for nebulized medications and have no underlying illness, some diseases commonly have these symptoms that need treatment.
Asthma, pneumonia, acute bronchitis, and chronic obstructive pulmonary disease are diseases that affect the lungs and the airways that can be helped by the use of nebulized medications but cannot be completely resolved.
One example of a medication used to treat wheezing and rhonchi is albuterol sulfate, which is a bronchodilator.
Albuterol sulfate can be nebulized or can be inhaled through a metered-dose inhaler, which may look something like this. Common side effects are chest pain, palpitations, tremors, nervousness, and restlessness, so monitor these after administration.
It is important to not exceed prescribed dosages and adhere to the dosing schedule of either a fixed schedule or the use of the bronchodilator as needed.
It is important to instruct patients to rinse their mouth and gargle after each nebulized medication use or the use of an inhaler. Good oral hygiene prevents candidiasis, which is thrush.
Thank you so much for watching our video on nebulized medications.
Thank you.